Let's talk about life under lockdown and how the world is closing borders and canceling events to stop the spread of this coronavirus.
COVID-19 has silenced entire cities.
We've shut up shop too. Here's our whole team, still working, but from home. And I'm in here. I'm quarantined inside a hotel in Doha after visiting family in Spain. But I know I'm not alone. So many of you have been told to self-isolate too. We've seen this outbreak evolve from a few cases of pneumonia in China in December to a global pandemic that's testing governments and people around the world.
This is not a time for panic. It's a time to be fully prepared.
There's a lot to make sense of, so it's worth going over the basics. What do we know? How do we keep ourselves and others around us safe? And how long is this all going to last? There's a lot we still don't understand about this coronavirus, but we've been speaking to experts all week who know how epidemics work, and they're saying this isn't going to end anytime soon. So the mission right now is to manage the spread. Scientists think that for every person who has the virus, between 2 and 3 people can get infected, so it spreads exponentially. You may have seen this curve that the Centers for Disease Control and Prevention put out. It shows what the outbreak looks like if we don't do anything. So there's a surge in the number of cases as the virus spreads, but the problem is there's a limit to how much health systems can cope with a spike like that. That's why experts say we need to flatten the curve, meaning we slow the spread and buy time so hospitals don't collapse.
You might have 1 million cases, but instead of over 1 month, you're bringing it down over 4 months or 6 months, which is much easier to manage from an infrastructure and public health standpoint.
So how bad could it get? Well, one study in the UK was pretty blunt. If we do nothing, and let's remember that's not what's happening here, but if we do nothing, the report says more than 500,000 people would die in Britain. Doing something, like restricting movement, say, could cut that number in half. But the study says a full-on offensive, meaning tough measures for at least a year, would drop the death toll in the UK to less than 20,000. And those numbers would be a lot worse in countries with poor health services, or countries that just aren't ready. In northern Italy, some hospitals were pushed to capacity.
It's a crowded, frantic, overwhelming place. The system is on the brink.
Doctors have been forced to choose who not to treat.
Comparing patients and choosing the patients who have the best possibility to survive. It's always emotional and difficult to decide.
Italy's death toll is now well past China's. Most of the dead are elderly. The army has had to transport hundreds of bodies to be cremated. No proper funerals, no time for goodbyes. Just a tribute in the newspaper's long obituary section.
8, 9 e 10.
It's heartbreaking, but we can take some comfort in knowing how this virus affects us. Most people show mild to moderate symptoms, from getting a cold to having pneumonia that doesn't require hospitalization.
We infected a lot of people not even knowing, and that's the issue, that if you're asymptomatic or you just have very mild symptoms, still stay home.
But many others are getting severely, even critically ill, and that includes younger people. A US study found that nearly 40% of Americans who had to be hospitalized were between 20 and 54 years old. But even those who get to stay at home don't have it easy.
I started having a headache on Tuesday, and then I started with a cough on Friday. And it was a feeling of drowsiness and trying to fall back. I just wanted to fall asleep. I didn't realize what it actually was until my parents came back positive with the test.
Then there are the people who are most at risk of dying from this virus. The WHO says that's anyone over 60 and people with underlying conditions or disorders. And we all know people who have them. Our friend with asthma, a relative who's going through chemotherapy, our neighbor who's pregnant.
My little one, especially if he were to get the virus, I don't know what would happen because he's got asthma and it would attack his his respiratory system.
So how do we protect ourselves? Let me just set something up. The WHO and the CDC say there have been a few cases of the virus being passed on by someone with no symptoms, but the risk is very low. The main way you get COVID-19 is from someone who is visibly sick. You can catch it from someone coughing, sneezing, or even speaking a little too close to you. But what if those droplets linger? A recent study suggests the virus can survive in the air for up to 3 hours. Now, say those droplets land somewhere. Well, studies show the virus can survive there too. On cardboard, it can live up to 24 hours, 3 days on plastic, 2 days on stainless steel. That's why the experts say wipe things down. Even regular soap kills the virus. Wash our hands, avoid touching our face, and stay at least a meter away from people if you're out and about. Finally, we just kind of have to put our old lives on hold. Shops and businesses have closed. People are losing their jobs. Countries aren't letting people in.
It's clear now that this is going to devastate economies in Europe and America.
More than 500 million children aren't in school. Even praying isn't what it used to be. Birthday parties, weddings, they may not happen this year. Not to mention all these events that so many people were looking forward to. Concerts, sports, film festivals, they're all canceled. So the question is, how long is this all going to last? That depends on where you live, how many cases there are, and how strict the lockdown is. But this isn't short term.
It's safe to say that we're going to be in this for at least several more months, that things are still continuing to ramp up. We don't even have a real sense of how many cases we have. I'll speak for the United States because testing has been severely lagging.
And that's a problem because the WHO says the focus has to be on testing.
We cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
The lockdowns help. We have more time to find out who actually has the virus and trace where it came from. Now, the tests can vary. It could involve taking a sample from deep inside your nose or throat, but that takes supplies and specialists.
Many countries have not been systematically testing all suspect cases. It's one of the reasons why we're behind in this epidemic.
At the same time, there's this hope for a vaccine, or that the virus might ease up in summer. The bad news is, yes, companies are working on a vaccine, but it could take years to roll it out to everyone. As for the warmer weather slowing this down, you just don't know.
Things that kill viruses are sunlight and drying out. But I want to be clear that we do not know and have no data to support the idea that this virus will go away as the seasons change and things warm up.
So the advice is to ride out the lockdowns as best we can. Reaching out to people and making one another laugh counts for a lot too. Here's some good news. China and South Korea, which saw the earliest peaks, took aggressive action and saw the number of cases drop dramatically by March. People have started going back to work. Businesses are slowly opening back up, but that doesn't mean we can relax.
There is a real risk that as some of the restrictions on society loosen and relax, we may see a resurgence of cases. And that's because it is so difficult to determine how many people are still getting exposed and infected that may not be reporting because they have mild or asymptomatic cases.
In short, we take this seriously, without fear. We listen to the experts, we stay informed, we look out for each other, and we carry on. We don't know when we'll be back on the Start Here set, but not to worry. We're still going to be bringing you more episodes any way we can. In the meantime, our website, aljazeera.com, has all the latest on the coronavirus pandemic. I'll see you next week.